We have a very common question in our office. What causes back pain? Particularly lower back pain, because that's one of our biggest complaints that we have in our Plano office here. I'm going to walk you through a few scenarios that can cause lower back pain and some of the actual symptoms that we see often in our practice. Then I'll let you know exactly what we can do to help all those issues. So one of the most common lower back pain is when the spine is out of alignment. This is a model that we have in our practice. From behind, ideally, we want to see our spine completely straight. From the side, we want to see our spine have curvatures. This model is facing this direction, so the normal curve is like this for the neck, like this for the mid back, and like this for the lower back. A lot of times what we'll see is when we take x-rays in our office, we see a spine that perhaps is curved this way, perhaps it's rotated like this, or maybe it's fine looking from behind, but from the side, either it has too much curve like this or not enough curve. All of these can cause a lot of stress to your spinal cord and your spinal nerves, which can obviously irritate it, leading to a lot of pain in the lower back. Other things that can also occur where this disc is actually herniated or bulging out. Here's a model of a disc that's herniated. It's this red part right there. This disc is actually sticking out and actually touching this nerve, this yellow part of the model. These are called nerve roots. And then right here is the spinal cord. A lot of times these discs are damaged or they're degenerative to where they actually shift out of position, touch that nerve, and it causes tremendous pain. It can cause pain to shoot down the legs or down to the feet and toes. Along with that, it could be numbness or tingling or weakness in the legs. If you're experiencing that, that could be a possibility. The other possibility that can cause pain in the lower back is degeneration. This is a degenerative model here. This is two vertebrae that's degenerative. The disc is degenerative, meaning that the disc is a lot smaller than it's supposed to be. There are bone spurs occurring around the bone structure of these two vertebrae. This is a healthy looking vertebra. See the difference there? We want you to look like this and not like this. And typically this occurs almost at all ages. We can see it as early as the early 30s and onward. If you are experiencing lower back pain, and you're not sure exactly what has caused it, there's no trauma, maybe you've had a chronic condition for a while and it's starting to get worse as the years have progressed, or you're just waking up with just pain in general, you're not sure exactly what's causing it, then come see us at BestLife Chiropractic in Plano. We can identify what the problem is through a proper exam and x-rays and figure out what is the best way to treat your lower back pain. It could be chiropractic adjustments, it could be spinal decompression, it could be corrective exercises, it could be a combination of all those things. We will only know the best way to treat you if we know exactly what the issues are. Like I said, it could be curvatures of your spine, it could be a possible disc herniation, it could be degenerative disc disease or basically degeneration of your spine, or it could be maybe a combination of all those. Let us figure out what it is and help you get out of pain.